Dr. Tony Filiano from Duke University, and he has just been awarded the first ever CBA Scholar Grant. Tony, can you tell us what department you're in at Duke University and some of the nature of your work?
Yeah, sure. I'm in the Department of Neurosurgery at Duke University. I'm an assistant professor in the Marcus Center for Cellular Cures, and the overall interest in my lab is looking at complex interactions between the immune system and the nervous system. And we hope by studying these complex interactions in normal physiology that we can learn about how these interactions break down in disease. And we're using cord blood and umbilical cord tissue derived cells to hopefully fix these deficits in these interactions.
Wonderful. What are your thoughts about the current state of cord blood science?
Yeah.
And where do you see it going?
Yeah, I'm really excited about the science behind cord blood. There's been incredible advances in the use of cord blood for transplantation, but recently we're starting to look for different indications for cord blood, and we're expanding beyond just the transplant biology and looking at new indications like autoimmune disease, neurological disorders.
What was exactly the topic that you were speaking on today at the discussion?
Yeah, so today I was talking about using an immune cell called a monocyte in cord blood. And monocytes are a very special immune cell. They can respond to their environment. They classically are known to fight infections, but they also have some tissue healing properties. They can go from the blood into the tissues and help regeneration. And so some of this work that we're doing is one, we're doing research using cord blood monocytes themselves as therapy, where we show that they're protective in like hypoxia and ischemia of newborns. Also, we're using the therapy to replace different types of cells in different tissues like the brain. And then lastly, one of the approaches we have is to use the monocyte in cord blood as a starting point and engineer new therapies for different neurological diseases.
Wonderful. It's exciting stuff.
Thank you.
And you said something during your presentation about the use of smart drugs in conjunction with this. How exactly does that work?
Yeah, so a lot of drugs out on the market now are small molecules. So you'll treat, and then they'll have a single mechanism of action, like a single target. With cell therapy, it's a little bit different. Cells can respond to their environment. They can sense situations. They can change, and they can potentially secrete tissue healing molecules.
I see.
We're actually using the cord blood itself. Okay. The idea would be, one, to transfuse the cord blood into the patients and see benefit there, but then also we can take cord blood, we can engineer different therapies and using cell therapies themselves as the product.
Great. What are your plans for how you're going to use the grant?
Yeah, thanks for asking. My lab's really excited about this, and it's going to give us the opportunity to not use cord blood itself, but actually use the umbilical cords. Oh. And using the umbilical cords, we can isolate a cell called a mesenchymal stromal cell. And we have some really exciting data showing some novel mechanism on how these cord tissue derived mesenchymal stromal cells can reprogram cells that are undergoing dysfunction in the body. And we think it could have implications for rheumatoid arthritis.
Wonderful.
And other autoimmune diseases.
That's wonderful. So like multiple sclerosis might be?
Yeah, that's one of our targets, looking at the role of these cells in multiple sclerosis.
Well, that's wonderful. Well, thank you for sharing your information with us, and congratulations again on
Thank you. Thanks for your interest.
Award. Absolutely. Thank you.